Pastor Sumatra Carter of the Williams Chapel A.M.E. Zion Church in Carlisle, South Carolina. As pastor and as a servant leader, it's important for us to not only provide spiritual and emotional support for members of our community, but also to make sure that you are up to date, that you are aware of information and resources that can greatly impact your health and wellness, as well as access to certain healthcare services. I am excited and glad to have Shelli Quenga, Director of Programs for Palmetto Project, with us this morning to share some important Medicare and Medicaid updates. So be sure, if you have any questions, to please drop those in the chat, and we'll be sure to get that answered for you. And Shelli, I turn it over to you.
Thank you so much. So, I'm really glad that you find this as important as we do, because, the vessel that we are given, we are also given the responsibility of caring for it. And part of that includes making sure that you have access to the health services that you need. And so one of the things that has been happening as a result of the pandemic is that many people especially who have children, have experienced that their kids have been on Medicaid continuously during the entire pandemic. So normally you would renew your Medicaid annually. And so you would receive a form in the mail. It would be pre-filled with some of your family information, names, address, phone number. You have a chance to make any corrections, if you've moved, if a child has grown up and moved away, gotten their own job, their own family, etc. But during the public health emergency, which is referred to as the PHE, during the pandemic, then the states had the option of continuing Medicaid for this entire period and not requiring anyone to renew their coverage, because we wouldn't want anybody to fall out when they're in the middle of a health emergency. You'd want to make sure that everybody had access to services. Well, we are anticipating, as the pandemic has waned and our numbers have gone down, that public health emergency will be coming to an end sometime around the end of the summer. We do not have an exact date yet. So that's really important to know, that there is no exact date when the public health emergency will end, but there are some clues that are telling us maybe it's going to be around July, August, September, somewhere around there. That means that everyone who has Medicaid will need to renew their coverage. And so how does that get done? So you have to receive that renewal application in the mail, paper mail. If you have moved during this last period of about 24 months, then you need to make sure your address is updated with South Carolina Healthy Connections Medicaid, which is also under the Department of Health and Human Services. So the South Carolina Department of Health and Human Services. So the first step that everyone needs to take is to make sure that their address is updated with Medicaid's system. Some people call their managed care company. So you should have 2 member ID cards. So you have one from South Carolina Healthy Connections that you would use for your dental and vision care for your kids. And then you would have another card from one of the managed care companies like WellCare, Absolute Total Care, Blue Choice, First Choice. So you would want to not call the MCO. Call Medicaid, your white card with the little green and blue gingerbread person on it. Those are the folks you would want to call to update your address. And then we would want you to confirm that the address has actually been updated. About a week later, call back, because unfortunately, there are 3 different computer systems that our Medicaid agency is using, and your address has to be updated for every member of the family in all 3 computer systems in order for you to get that accurate annual review or renewal packet so that you could send it in. So the most important thing, of course, then is to make sure that your address is updated in the system. There is also a form that you can fill out and you can send in, you can take to a county office, you can fax it in, you can email it in, like an e-fax. That is possible. We prefer that way, so there is a paper trail showing that you did request that your address be updated. And this is not the same as doing a forwarding address with the Postal Service. So this is a separate process, because even if you did that forwarding order from the Postal Service, it will not affect the delivery of this review notification, because it contains protected health information like your children's names and dates of birth. So they may not forward it to your new address. They literally are not allowed to forward your review application to your new address. So it would get returned back to the Medicaid agency. So it's so important that first you make sure that the Medicaid agency has your correct address. If they do have your correct address and you're able to verify that, then the second thing you need to do is look out for any correspondence by paper mail from the South Carolina Department of Health and Human Services or South Carolina Healthy Connections Medicaid. So it may look like junk mail, because it's going to be a pretty thin packet for the first mailing to tell you that they are going to renew your coverage. And then you're going to get a thicker packet. We believe that's the way it's going to happen. But our state still has not announced a firm plan of how they are going to do this whole process, which is referred to as the unwinding of Medicaid after the public health emergency. So as they unwind this process of having all these people continuously eligible, we think they're also going to do that in phases. So maybe the first category of people who are going to be notified are those who have children who have turned 19 during the time of the pandemic. Those kids, even though, I think of them as kids because I have some of those folks who are young in my family. So those young people may still have Medicaid, even though they've turned 19, when under normal times, they would not be eligible for full Medicaid benefits, even if they're in college. So you will have some time to figure out what your other options are for getting coverage for that adult child. Maybe they could be on your coverage through your employer. Maybe they are working and they could be on coverage from their employer. They might be able to get coverage through the Affordable Care Act. It's possible that they might be eligible for a different category of Medicaid, but it's unlikely. So we would probably be looking at other care options. So we at the Palmetto Project are happy to help people with this whole process. So folks can call us, they can email us, they can even text us, and we can help them with that process to get that change of address form. We can submit it for them and follow up on it. And then we can also help them get that annual review or that renewal application submitted. We can look for other sources of coverage, especially for your adult children who have turned 19, who would no longer be eligible for Medicaid unless they have become parents themselves. So you might have some folks who have received a card in the past that looks like the Healthy Connections card with the little gingerbread person on it, but it will say family planning waiver on that card. If you have a card that says family planning waiver, that is not full Medicaid coverage. So that will only cover you for a biannual physical, so once every 2 years. an annual gynecological exam if you are a woman, and birth control. So for men, it's nearly entirely useless. You can get a physical every 2 years, and you could get a vasectomy if you wanted it, and free condoms. But that's usually not, a vasectomy is not something that your 19 or 20-year-old adult child is going to be looking for. So in order to get the full coverage, so let's say I have a physical, which would be covered under this, if they discover any problems, like you have high blood pressure, your sugar levels are high or something, there's no coverage to do anything about it. So that family planning waiver really is a very limited benefit type of coverage. So in no way should you consider yourself as having full coverage if you have a card that just says family planning waiver on it. There are also some other organizations in our state who could help you. So in addition to Palmetto Project, if you would like another organization to help you with your Medicaid application, you can also go to SC Thrive, and they are available to help you complete either an initial or a renewal Medicaid application. They will get that application submitted for you, and then it would be up to you to follow up on that submission and find out where it is in the process of being reviewed. With Palmetto Project, we will submit the application for you, and then we'll also do the follow-up for you. You can also go to your Medicaid office. You can update your address in person. You can request a copy of the application, and you can complete it and turn it in right there at the Medicaid office. One of the challenges, though, with doing that is that the Medicaid workers at your county office are not allowed to help you complete the application, and it's 14 pages long. So it can feel a little bit cumbersome. So they may refer you to Palmetto Project or SC Thrive to get help completing that application if you need it. And unfortunately, our county offices are only open Monday through Friday, like 9 to 5, 8 to 5. So if you're working during that time, you may not be able to get there. You could certainly call them. So the Medicaid office number is 888-549-0820. So you could call Medicaid, or you can also call Palmetto Project. And if you need an after hours appointment, we'd be happy to meet with you after normal working hours, because we don't want you to take time off and lose money, lose pay if you have to take time off without pay. We don't want you to do that in order to get access to a service that you're eligible for based on your income. So, a family of 4 making around $55,000 a year can get coverage for their children. So Medicaid covers a lot of the children in our state. More than half of our kids, more than half of labors and deliveries are covered by Medicaid in our state. So Medicaid is a really important coverage category for our children and for pregnant women and people with disabilities. So if you've got folks who have been found eligible for disability through the Social Security Administration, those folks might have Medicaid also. So there are lots of resources out there to help, but it's super important that people really prioritize right now. This is the time to make sure that your address is correct in the Medicaid system, so that when it's time for them to mail out those notices, that you either get the renewal form in or your coverage will be terminated in 60 days. This is the time to get that address updated, so you're going to receive that form. You can also follow Palmetto Project, or there's another organization, South Carolina Appleseed Legal Justice Center. Both of us are watching and talking to Medicaid and trying to encourage them to get that plan submitted for how this whole unwinding is going to happen. So we will also have updates on our social media feeds. As soon as we find out what their plan is, we will be sharing that with everyone, so you'll know. Pastor Carter, I know we had talked about going over some information about Medicare too. Do we have time to do that today also?
Oh, yes, ma'am, we sure do.
Okay. So Medicare, as complicated as all that sounded with Medicaid, and if you've ever tried to look for coverage in the Affordable Care Act, the marketplace, health insurance marketplace, healthcare.gov, Obamacare, whatever you want to call it, you've tried to get insurance through that avenue. It's complicated. Both systems are complicated. Their level of complication, though, pales in comparison to how complicated Medicare can be, which is so sad. When you're eligible for Medicare, typically when you turn 65, so you feel like you've done all the hard work and you finally reach 65 and you get Medicare. Whew, this is going to be great, right? It's super complicated, and the decisions that you make about your Medicare coverage can be binding for the rest of your life. So these are really important decisions to make about what type of Medicare coverage you want, looking at the cost of that Medicare coverage, what your current conditions are, how much your medication is going to cost. There's so many different ways that you can get covered, and it's an alphabet soup. So you might hear people talk about how Medicare is free. That's only partially true. So Medicare comes in several parts, two main parts. Part A is free. If you've worked at least 10 years or 40 quarters you've worked, then Medicare Part A is free. There's no cost to it. Great. Except it only covers hospitalization. And it doesn't even cover a lot of the doctors that may come and see you when you're hospitalized. So it really covers like your room and board when you're in the hospital. And it only covers 80% of those costs. So then people find out they have to get Part B of Medicare, because that covers things that happen outside the hospitals. That covers doctor's visits and labs and x-rays and outpatient surgeries. You need Part B. But there's a premium for Part B, and right now that premium is $170.10 a month. That's a lot of money every month that is going to come out of your Social Security retirement benefit. And still together, Part A and Part B only cover 80% of your medical cost and no prescriptions. Okay, so this is just medical care, no prescription coverage. It covers 80% of the cost and it leaves you with 20%. Now, if you've had employer-sponsored coverage, an 80-20 plan, it's pretty common. Most of us have that. The difference is, though, with Medicare in that 80-20 plan, there is no annual maximum out-of-pocket to your 20% in Medicare. So with your employer-sponsored plan, maybe you had a $5,900 annual maximum out-of-pocket, meaning if you were in the hospital for months, the most you would pay for your medical care is that maximum out-of-pocket. With just original Medicare, Part A and Part B, there is no maximum out-of-pocket for that 20%. So in a good year, great, maybe it's 20% of 500. In a bad year, though, what if it's 20% of 5 million, which isn't hard to hit if you were in the hospital in ICU. So that's why the government introduced Medicare supplements and Medicare Advantage plans. So there's these two options that you can choose, these two pathways that you can choose, and both of them help you put a lid on that maximum out of pocket every year. But you still haven't heard me talk about drug coverage. So drug coverage is still separate from that. Okay. And the challenge is if you don't enroll in these things when you are first eligible and you are not covered by any employer plan at that time, if you don't enroll when you're first eligible, you could be assessed a late enrollment penalty, and that penalty will continue for the rest of your life. So it's not as if it's a slap on the hand, oop, for this year, you didn't enroll, and so there's going to be a late enrollment penalty for the rest of this year. No, it is every month for the rest of your life that you would experience this late enrollment penalty. So it's super important if you are approaching 65, you know that they're trying to come and find you anyway because you're getting tons of mail from Medicare plans. But get the information, make an appointment to meet with someone either at your area agency on aging or make an appointment with a licensed insurance agent in your area, not somebody over the phone. You want to meet with somebody in your area who knows your hospitals, knows your doctors, and then get the lay of the land about 6 months before you turn 65. So that way you'll know what's coming up. You'll know how much of that stuff you can throw away that you're getting in the mail because there's going to be so much of it. And then before you turn 65, you'll know exactly what your coverage plan is going to be. So you don't have to stress about it when you're in that birthday month. You don't want to wait until you turn 65 to figure this all out. Now, we at Palmetto Project can also help you through that Medicare process. There are some ways that you can save money in Medicare. You might be seeing a lot of those ads. You probably saw during the enrollment period in the fall, there were a lot of ads that talked about save $170 a month. They were talking about that Part B premium because there are some people, based on your income and your resources and assets, that may be eligible to have that Part B premium paid for by South Carolina Medicaid. Now, you may have never been eligible for Medicaid as an adult, except maybe when you were pregnant. But now that you've turned 65, you might be eligible for Medicaid to pay that Part B premium. So you would have to apply to South Carolina Medicaid to see if they can help you pay for Medicare. So it's also really counterintuitive, that you would think, now that I have Medicare, why would I be looking at Medicaid? But that is the situation. That's how you get financial assistance with Medicare, is to apply to South Carolina Medicaid. We can also help you with that process. SC Thrive can help you with that process. Your local licensed insurance agent may be able to help you with that process, but it's definitely something to check out. I say nothing ventured, nothing gained. You won't know if you're eligible unless you ask the question. You won't know how much you could be eligible for. So some people may be eligible for Medicaid to just pay that Part B premium. Some people may be eligible for Medicaid to pay their Part B premium and pick up all of their other medical costs. So they would pay nothing. So it's really based on your income and your assets and resources. So if you have a vacation home, if you have rental property, if you have other property that you own, even if it's just land with nothing on it, those assets are counted, and they can be counted against your actual income. So all of those things we would want to take a look at to see if you might be eligible, and give all that to Medicaid for them to make the final determination. But there are some ways that you could save money in Medicare. So we really want to make sure that people are accessing those. The reason why we are so passionate about this with Medicare and Medicaid is because we know that about 50% of South Carolinians who are over the age of 65 and low income are eligible for these Medicare savings programs, and they are not enrolled. So we're talking about very low income seniors. Perhaps their Social Security retirement they receive is less than $1,000 a month, and they are having to pay that $170 a month. They shouldn't be doing that. South Carolina Medicaid could be paying that premium for them. There are also other programs, other types of Medicare plans that could give them additional benefits for dental and vision, over-the-counter products to buy things like aspirin that your doctor's prescribed but isn't covered by your insurance. They could help to zero out your prescription cost, which would be super important if you're diabetic. If you've got lots of meds, you want to see if there's any assistance for those. So we can assess that and determine if there are any programs out there to help you and get you connected with those, because, you need that extra money to pay your light bill. You need it to pay for gas, Lord knows, to get to the grocery store. So there's a lot of other expenses that you have that if we can get you resources to cover this medical expense, then that frees up your Social Security to pay for other things that you're going to need, repairs on your home and those kinds of things. So super important stuff that, just because your other family member or relative doesn't have it, or doesn't know about it, doesn't mean that you might not be eligible. So we really encourage everyone to ask for themselves. Medicare is so different, even in that husbands and wives could be on different types of Medicare plans. So it's not like employer coverage at all, where you just kind of take your spouse along with you and they're in the same insurance plan you are. Once you hit Medicare, you could be in one type of plan and your spouse could be in a different type of plan, because your medical conditions and your prescriptions are very different. And so you want to be in what's best for you. It's very individualized in Medicare, which is so different from typically what our experience is all of our adult lives. Do you have any questions, or have we gotten any questions on the Facebook?
Miss Shelli, I'm just blown away. 50% are eligible and do not know it. Wow. Yeah. That's a lot.
It is. And, I don't think anybody would be proud to come out and say, hey, I only get $700 a month for my Social Security. So
Right.
These aren't people who are proud to come to you and ask for help. But you've paid taxes. You're getting that Social Security benefit because you've paid taxes all this time.
Right.
These
Wow.
taxes are what helps to cover the cost of these benefits of Medicaid and Medicare. So, now is a time, if your check is under $1,000, you definitely need to reach out to someone and find out what you're eligible for and get some of that money back that you've been paying in for all of your working life.
Wow.
This is kind of the system. We help people now while we're paying in. And then they're helping us. So young people, once we turn 65, then young people are helping us.
Right.
While we helped them maybe with Medicaid when they were kids. So, it is all about us helping each other. It is a safety net, that we want to make sure we catch everybody. We don't want anybody falling through that and feeling like they're alone and don't have any help. Because, there are folks who are trained who can help you, that you can meet with in person. We can video chat like this. Now that the pandemic is waning, we're back to doing home visits. So we can actually go to someone's home and meet with them there. We really discourage you from calling, the numbers that you see with celebrities on TV. Those are humongous call centers. They don't know the hospital systems in our state. So when you tell me that you need to go, let's say, to Toomey, I know that Toomey's now called Prisma, but that person on the phone, they don't know that. So we can help you look at those networks, make sure that your doctors are still covered, tell you exactly what your medication is going to cost, all of those kinds of things. So just super important that you get all of these facts from somebody that you can really trust.
Very important. Thank you so much. Tech support, we have any questions?
We have 3. Okay. First question is about Medicare. If a person moves from another state, how does that affect your insurance coverage? And does your coverage change?
It depends. So here's another place where Medicare is complicated, right? So if you move from another state and you have a Medicare Advantage plan in that other state, then you would definitely want to change to another Medicare Advantage plan, because you want one that's going to cover the network of providers in this state. So you would want to reach out to someone so that you could change plans to a plan. So let's say you moved here from Georgia. There are Medicare Advantage plans for Georgia. You would want to move to a Medicare Advantage plan for South Carolina. Now, it might be with the same company. So it might be the same with Aetna, Humana, a Blue Cross, but it would be Blue Cross of South Carolina. It would be an Aetna plan specific for South Carolina in our networks. If the person who's moving is on a Medicare supplement in combination with a separate prescription drug plan, the benefit of a Medicare supplement is that there is no network to think about. So you can take that plan and go to any doctor in the country who accepts Medicare if you have a supplement. So you wouldn't change that supplement. You might change your prescription drug plan, though, when you moved. So I would say if you're moving to a new state, find a licensed insurance agent or your area agency on aging and talk to them to see if you need to switch based on the type of coverage that you have. If you had financial support, the Medicare Savings Program from that state that you moved from, that does not carry over. So Medicaid does not travel from state to state. So if you had your Medicaid agency paying your Part B premium in your previous state, you would need to reapply for that in South Carolina when you moved here, because Medicaid does not jump from state to state. So it's a great question.
Thank you. Question number 2. What are the public health emergency protections?
Great. So the public health emergency protection meant that during this public health emergency, Medicaid could not discontinue coverage. They could not terminate coverage for any eligible person unless the person requested it or the person moved out of the state. Because remember, I just said that Medicaid is awarded on a state-by-state basis. So if you move to another state, your South Carolina Medicaid would terminate, and you would then apply for Medicaid in that new state. And vice versa, if somebody moved to our state during the pandemic, they could apply, let's say last year, they applied for Medicaid. They're continuously eligible until the end of the public health emergency.
We had another question coming in. What does this mean for Medicaid beneficiaries and advocates?
Sure. So one of the things to remember, of course, is that you need to get your address updated if you are a current Medicaid member, because you want to make sure that when the public health emergency ends, that you are receiving notification that you need to renew your coverage or it will be terminated in 60 days. So you'll have 60 days from the time you receive that notification to get that application in the mail. For advocates like us, what's super important is to tell everybody that you know. If you know somebody who has Medicaid, is your address updated in their system? And if it is, then look in your mail, make sure you're going through what you think might be junk mail. If it says Healthy Connections, South Carolina Medicaid, or South Carolina Department of Health and Human Services, open that mail, because that could be your notification that your coverage will be terminated within 60 days.
And the final question is from someone on our YouTube channel.
Mm-hmm.
Where should I go to find all of this information in writing?
Well, we covered a lot of different systems. So there's information in different places. So if you're aging into Medicare, there is a booklet that you are mailed and that you can also go online to get, called Medicare and You, that explains Medicare in great detail. South Carolina Medicaid, there is no such document. And there are 32 different types of Medicaid in our state. So you may be enrolled in one type of Medicaid coverage, and a friend, family member, coworker could be enrolled in a different type of Medicaid. And you both might say, I have Medicaid, but they could cover different things. So I think for Medicaid in particular, you really need to reach out to a nonprofit like Palmetto Project, South Carolina Thrive, Appleseed Legal Justice, your local federally qualified community health center. You can go to them and get assistance. If you want to know who your federally qualified health center is, you're welcome to call Palmetto Project and we will tell you where that community health center is for your area. But reach out and get some information, sit down with somebody, because, I've kind of been talking almost nonstop for 35 minutes. And there's just so much information. There's so many different options. There's so many different avenues and nuances, because everybody's family situation is different.
Mm-hmm.
Their income situation is different. Their assets and resources situation is different. So rarely do I talk to somebody that I say, oh yeah, I just helped 5 people who have your exact same situation.
Mm-hmm.
That doesn't really happen. So you really need to reach out and talk to somebody. And I think if you sit down with somebody, we have a couple of documents that we can share. We can certainly put those, share those. There's like a Medicare choices illustration kind of page that we could share. We can put up the link to the Medicaid application, to the address change form, all of those kinds of things. But I think it's important to sit down with somebody and talk through what your
Mm-hmm.
specific situation is so that you know which direction to go next.
32 plans, Miss Shelli.
32 different types of Medicaid. Yeah. I mean,
Wow.
if you have breast and cervical cancer, there's a
Mhm.
specific Medicaid for that.
Oh,
If
wow.
you, the family planning waiver, there's that type of coverage. There's specific coverage for children who are in foster care. There's emergency Medicaid. If you went to
Mm-hmm.
the emergency room and had a true emergency, but that's just for the emergency room. It doesn't help you with anything else once you
Wow.
leave the emergency room. So all different types of coverage. And then Medicare, there are 54 companies that sell Medicare supplements. There are many companies that sell Medicare Advantage plans, and each company has many Medicare Advantage plans within their own company. And then there are separate prescription drug plans. So yes, it's crazy town.
Wow. Awesome. I'm so grateful. Um, do we have any other questions?
That was all the questions.
Okay, thank you so much. So a couple of my big takeaways is that renew for Medicaid is that renewal or annual application. Check your mail; it's not junk mail, and make sure to update your information. You said it's 60 days, and also being mindful of the eligibility requirements and the application 14 pages. So that means do not wait to the last minute to try to
Exactly.
get that completed. Wow. And as she said, 50% with of our Medicare, people who are eligible and do not know. So that means take this broadcast, take this information and share all over different social media platforms. Miss Shelli, I'm so grateful that you were able to come. I thank God for Meredith and connecting us so we can get this information out to our community. It's definitely have been a blessing to me, and I'm sure to others who are going to be able to go back and replay this video to get this information. And we also have her contact information that we're going to be sharing as well on how to contact Miss Shelli. All right, any last minute thoughts or information?
Don't forget the tax day is coming up on April 18th. There are sites out there that can offer free tax assistance. So,
Oh,
if you need help finding one of those sites, feel free to call us at that toll-free number and we can help somebody find one of those sites. You can still get a COVID vaccine. We can help you find where the nearest vaccine location is for you also. So, if you need help, give us a call. If we can't help you, we will find somebody who can.
all right. So there's no excuse for not to have say you do not have resources because we have given you that information today. So thank you again, Miss Shelli, and I thank everyone who's able to join us or who will go back and watch this and share our information later. So thank you, and you all have a wonderful rest of the day.
All right. Bye-bye, everybody.
All right. Thank you.